Healthcare systems everywhere are struggling, and they're struggling primarily for two reasons. One is demographic change. So there's too many of us already, frankly, but on average, we're all getting older as well. And that means we're developing far more complex healthcare needs. The other challenge that healthcare systems have got is that there's just not enough qualified people in those systems or coming into those systems to help meet that growing demand. So we already know that new technology is going to play an increasing and oversized role in helping us to meet these challenges. One of the companies that's right in the center of that is Canon Medical Systems. They produce diagnostic devices, the sort of machines that we're all probably familiar with. MRI scanners, CT scanners, X-ray machines and the like, as well as the IT and infrastructure around those, as well as the data processing and the analysis that enables us to really get the most out of those machines. Today's podcast, however, is stimulated by the fact that Canon Medical Systems, here where I am in the UK, did something quite novel and interesting in October last year, 2023. Canon Medical Systems built a basketball arena in the 10th largest city in the UK. There's a bit more to it than just providing a home for a basketball team, though. So to find out more, I invited Mark Hitchman, the Managing Director of Canon Medical Systems in the UK, onto the Tech for Good podcast to explain a bit more about what that is, what kind of clever healthcare things they're doing within it for that community, and then how that plays a role in Canon Medical Systems' view of the future of healthcare.
Well, Canon Medical Systems actually was Toshiba Medical Systems as a global company until 2016, and then Canon bought us lock, stock and two smoking barrels, the whole global business from Toshiba. So we've been under the Canon umbrella for certainly a good 7 years now. And I think the big interest was that we are one of the few global suppliers and manufacturers of CT scanners, MRI scanners, ultrasound machines, X-ray machines, healthcare information technology, all in the diagnostic imaging space, the sort of things you would find in what was, in an old-fashioned sense, called the X-ray department. It's now called the radiology or imaging department.
Right, got it. And so obviously in the UK, and just like lots of other countries that you operate in around the world, you're providing equipment that's vital to one of the core issues that the healthcare system has now, which is, and I guess it's a similar story in most countries, where access to diagnostics in a timely fashion, whatever those forms of diagnostics might be, has a huge impact on likely outcomes for patients. If you can get someone tested and understand what's going on with them early, then you're going to win, right? So as part of that whole story, I guess, Canon built an arena for a basketball team. And it opened in, there's a bit more to it than that, but it opened in October last year. And perhaps you could fill us in on what that is all about, because it very much is, as well as basketball happening, it very much is aimed at delivering healthcare much closer to the community, right?
Yeah, thanks. And there's a big picture story around that, really. We've always known that early detection of disease equals lower unit cost to treat the disease and better outcomes for patients. We therefore know that moving diagnostics into the community and even examining people who are asymptomatic, so not people who are presenting with a pain or another symptom, but actually have no symptoms. They may have risk factors. They may be aged over 50. They may have a history of smoking. They may have family history. But examining asymptomatic patients in the community is one of the major answers to some of the big questions to the rising costs burden in Western economies for healthcare. And so when the opportunity came along to build, as you say, an arena in Sheffield on the Olympic Legacy Park, it was more than an arena for us, and it was more than professional sport. It was about getting diagnostics into the community, and therefore it's not just a sports arena, it's not just a public arena, it's not just a community wellbeing arena. It is also, in one end of it, there's also a clinic on multiple layers of CT scanner, MR scanner, ultrasound, X-ray, healthcare information technology, minor ops operating theatre, and more as time goes on. There's spare capacity for more things, physiotherapy, endoscopy, to come in. So this is integrating professional sports, community well-being, and diagnostics and research in one place, and that was the appeal to us in pre-pandemic. So if we used to talk about things as a milestone as since the war, now it's since the pandemic or before the pandemic, and
It's an epochal line in the sand, yeah.
so this was pre-pandemic, 2019, and it was my and a couple of colleagues' lockdown project, being constantly on calls, on Teams meetings with architects, quantity surveyors, city planning, all sorts of entities, and to try and crystallize this and bring it together. And yeah, we got it over. We got it over the line. Fully funded by us, designed by us, with key partners we can talk about. And yeah, it opened October last year.
Yeah, so it's a really interesting initiative, and the idea that you've got access to all of that really advanced diagnostic type equipment, as well as medical expertise and procedures and things, even that you can access at the same time as going to watch the Sheffield Sharks basketball team, or the Sheffield
Yeah.
Hatters is the women's team equivalent, who play there as well, is an interesting area. Now, why did you pick that part of the country in particular? Because obviously part of this is to test the efficacy of a facility like that.
Yeah.
But why there? Why was that the best place for it?
We it was some serendipity that led to us being involved in this journey. So it wasn't the case of let's do this, where shall we do it? We had a long-standing relationship with Sheffield Sharks professional basketball, because their outreach program is the Respect program for children from challenging backgrounds. We've sponsored that since 2017. We sponsor a teacher for kids that have come from challenging backgrounds, and they get excluded from school, and they end up in gangs, and lots of unpleasant things can happen after that. So this project we were already involved with, and so by getting sort of emotionally involved with the basketball team, the players get involved to go to the schools to coach the kids, and the kids come and be coached by the professional team as well as classroom work with not just the teacher but also professional basketball players. We became sort of attached to them. Part of the appeal with Sheffield was it's a Sheffield Olympic Legacy Park. It's an incubation hub. So already there's University of Hallam with the Advanced Wellbeing Research Centre on the park. There's professional sport as well with Sheffield Eagles. There's a technical college, and there's soon to be a Child Health and Technology Research Centre driven by the NHS. And there's more to come. So it ticks a lot of boxes, and it is a northern city. It's about the 10th biggest city in Britain, and it has health challenges like many cities, which seem to be worse in the north. There's big disparities in life expectancy from the poorest parts to the wealthiest parts, and this is domiciled in the side of Sheffield where there are more socioeconomic challenges, and so the more we went down, does it tick all the boxes? Yes, it did, and so that really helped.
Right, and presumably you're now a resolute basketball fan, I'm guessing.
Well, yeah, one of the most emotional days in my life in recent times was the first professional game in there in early October, and Sheffield Sharks won. And I think for myself and the owners of the team and the players, it had been a long journey. They'd been renting and hopping around, for professional matches and training, and not being able to do the training they wanted to do. So yeah, it's a burgeoning sport in Britain. I mean, it's huge in the States and several other countries, but it is burgeoning here now, and it's on Sky Sport. It's even beamed in live to the United States now. So it's a really interesting, and some of this outreach program comes from the States. Atiba Lyons is the head coach at Sheffield Sharks, and he was part of the whole family commissioning group as a volunteer in New York before he came over here as a player and then a coach. So
Okay.
It's really quite contagious, the feedback that you get from these causes once you get involved.
Right. And so there's a rich narrative there about the origin of the idea, but now of course it's been running for a few months.
Yeah.
What can you tell us, I guess, about how it's gone? But further than that, how it will now be validated. There's all sorts of interesting things being incubated on the park in terms of the NHS are involved, academic institutions. There's research going to be going on at the Canon Medical Arena as well, presumably. So, what does the next 1 or 2 years look like as you look to validate the impact that it's got on the community?
Yeah, and there's multiple layers to that. Living care of the entity that operate the diagnostic side. They're a very capable, respected private entity in private healthcare, but very much value partnership with NHS. They've already started screening NHS patients with NHS contracts in there. For example, they've started screening prostate using MR technology, which is the gold standard. So, and that's just one example of something that's underway that was meant to be, and there's more to come. In fact, they're becoming quite busy. And on the what I call the arena side, which is the sport and well-being side, we brought the Sheffield Hatters under the roof. They were not really part of Sheffield Sharks until we crystallised the relationship with this. And we wanted them because we wanted the female professional team as well in, and so that the girls and young ladies had female role models, and we had strong equality side to all of this. And they have their own outreach programs as well. So, and in the arena side now, it's not just about basketball. There's professional netball, John Field netball team, and we've hosted already quite a few other sports. There's been professional karate championships, sword fencing, boxing, and there's even been an opera singer in there testing it from the Philharmonic Orchestra, and who said the acoustics, which we were proud of the fact that he was very happy with the acoustics, because we have designed acoustic capability into the roof, the ceiling, and the walls. So it's a really versatile space.
I am kind of surprised. So earlier on in the podcast, what we will have almost certainly done is layer over a few photos and images, or while you were describing the arena from when the ground was broken to being built. Looking at that structure, the acoustics for opera singers is probably the last thing that would have crossed my mind. So you've thought about a lot of things in building it as a multi-purpose arena.
Yeah, I think you start off with something that's not too expensive, because it's not normally what we do, and therefore square. So we wanted it to be a really cool design. We wanted it to be really attractive, where people want to be in there. It's inspiring as a space. We wanted it to be versatile for live music. You're not going to get the big bands in there, the big groups, but you can have music in there that is opera, for example.
Yeah.
And so the more we drilled into it, the more we thought, well, it needs to have this. If we just spend a little bit extra and have this capability, it reaches an even wider audience,
Yeah.
as a real center of social gathering as well.
Yeah,
So yeah.
and finally, before I ask you questions about Canon in the wider world and its big strategic goals and so on, it's also carbon neutral, is it? I believe so. It's been an arena that's been built from the ground up to be sustainable as well. What can you tell us about that?
Well, we are a United Nations accredited partner. So for the SDGs, Sustainability Development Goals, there are 17 of them. We're accredited for 4. You have to have 3 years of quite stringent activity for each goal of what it is that you're delivering. We should get another 2 this year. It's really important to us. Things like things like clean water in Uganda. That we drilled deep water boreholes through the United Nations scheme, so children can go to school. They're not just walking 5 miles to a river to fetch dirty water back to the family. And some of our staff have been there to see what it is that we're doing. So things like that were really important to us even before we started the arena. After the arena, because we've had carbon neutrality status through the United Nations now for a good 6 years, this had to fall into that category. And so offsetting all of the energy for all of the shipping, all of the building, and the energy it consumes, and it's very energy friendly. We've designed that into it as well. so that it is the UK's first carbon neutral arena actually.
Yeah, and it's interesting to you were talking about, actually you've thought about how the thing got built in the first place and how things were shipped there and what the cost of that. So you're actually looking across the whole kind of scope 3 spectrum there as well in terms of
Yes.
the value chain beyond the arena itself.
Even the energy that it consumes in the next 20 years will invest into United Nations schemes.
Brilliant. So talking about global things, this is one part of obviously a very large and significant company in healthcare that's doing quite a lot in the UK. What can you tell us as from your position above the whole piece? What else is going on around the UK in terms of innovation and new ideas such as this?
Well, we are Canon Medical Systems UK, but also in Edinburgh, in Scotland, is Canon Medical Research Europe. And there's about 150 people there researching artificial intelligence, neural networks, machine learning. And they've been there for years. They were all about image presentation, image analysis before AI became a really burgeoning topic. AI in our space carries many capabilities. We've been delivering it to the NHS for a few years now. AI that improves the image quality off a scanner. We've taught the scanner what is noise, what is artifact in an image, so you get less repetition, faster imaging, less radiation if it's a CT scanner giving off X-rays. So all of that we've been delivering, but the next phase is decision support AI. That is AI that recognizes disease in the scans and helps the doctors make quicker, more accurate diagnoses, or perhaps one day runs autonomously in certain settings with the right governance. And so, but one thing AI needs in decision support for diagnostics, it really needs to have seen a lot of data. And so the arena will generate data, but we also want to work with partners on the park there to access other data in a safe haven, trusted research environment. And that's the journey that's underway at the moment. And because, as I've said before, if we're screening asymptomatic patients more and more in the future, we've got to find a way to be able to diagnose more and more images and scans for disease. And there aren't enough trained professionals in this space, the senior doctors, the radiologists and the radiographers. So AI is probably going to be capable of augmenting with them, not replacing them, but working with them to help them work quicker, but with greater accuracy. And that's what we're really drilling into now. And the arena is a crystallizing event for us to bring lots of partners together in Sheffield.
Brilliant. Yeah. And so how does that factor in, I suppose, to Canon Medical Systems worldwide in terms, because I mean, in particular around AI, we've covered a lot of or published a lot of content around the potential of AI to really revolutionize healthcare. Obviously, you've spoken about a few of those things from a diagnostic point of view, but there's AI that can be helping physicians and radiologists and so on, as you've been mentioning, in the process of doing their work, by shortening the amount of time it takes them to make decisions potentially, but maybe more importantly is helping doctors to just spend more time face to face with patients rather than patient over there somewhere while tapping away on a screen. There's all sorts of important things. How would you characterize Canon's position in all of that, globally from a top strategic point of view?
Well, I mean, ultimately, we're moving towards precision medicine. There's lots of patient pathways which are hit and miss still. I mean, 10 people roughly the same age and sex with the same disease can present in 10 different postcodes and have 10 different outcomes, and that applies to every part of the world. Precision medicine is about the fact that we're all unique and we all respond to treatments in a unique way. You might be allergic to penicillin, or I might be, but vice versa, not so. We know that these things exist. We might respond differently to chemotherapy versus radiotherapy versus immunotherapy if we had the same disease. Precision medicine is about mapping the genome and understanding the individual's history, family history, genome map, other biomarkers from pathology to diagnostic imaging, And understanding, and that's where AI can add a lot of value, is when it's seen all of those biomarkers for the unique person, it can say the most probable treatment pathway with the best outcome is this one. It's not radiotherapy, it's chemotherapy. But for him or her, it's the other one, it's the other treatment pathway. And so getting that really accurate means we take out the trial and error out of treatment pathways for patients. We have better outcomes, lower unit costs as well. So early detection plus precision medicine going forwards are really powerful. In terms of, we're really worried about how many patients are burgeoning in many countries. We're living longer, more treatable diseases longer, growing populations. We need to be more efficient, and that means we need to treat people, we need to treat the individual and the individual's disease rather than give them a generic pathway. And that's what we're trying to work towards.
Great, that's good to know, Mark. We've got the arena in Sheffield now that is a beacon, an example of how all of these things might be able to come together and make a real difference in one place. Hopefully, we will see a lot more of that kind of thing happening, whether it's stimulated by Canon or others in this country, and hopefully we'll start to see a lot more of that kind of thing overseas as well. And through that, we might be able to see things like AI and other new emerging technologies start to play a role in solving some really pressing challenges that we've got with our annoying propensity to be higher in number and greater in age than we ever were. So thanks very much for spending loads of time with us today. Anybody who would like to know more about the arena and other things that Canon Medical Systems is getting up to, come to techforgood.net, where you'll find some additional content. In the meantime, thanks very much again, and all the best for the future. And I hope the basketball goes as well as the arena has.
We hope so. Yeah, we're fans now, so we're in deep. Thank you very
All
much.
right, thanks again.